Figuring out healthcare can be a challenge for anyone. For LGBTQ plus people, it can be even more challenging. People in this community experience healthcare disparities and barriers. We'll look at how this affects access, plus gender-affirming care and how it's changing the lives of transgender youths and adults.
You're going to see yourself the way you saw yourself in your dreams.
And mental health is just as important as physical health. The stigma and discrimination faced by some can lead to anxiety and depression, and can also make it hard for people to seek help.
When you don't have those basic needs met and you feel alone, that's devastating to your psyche, your mental health.
We'll explore these issues and more straight ahead on this week's edition of Prescription for Life. Welcome to Prescription for Life. I'm Monica Robbins. According to a 2021 U.S. Census report, the LGBTQ plus community is the fastest growing minority segment in the U.S. Today's show is all about taking off the blinders when it comes to issues and obstacles facing this community and what can be done to rectify the problems. Our expert will take a look at some of the disparities and why they exist. But first, a recent report sheds light on some of those disparities in what it calls a first-of-its-kind study. The American Cancer Society found LGBTQ plus individuals are likely at higher risk for cancer. The study looked at cancer prevalence and modifiable risk factors in the LGBTQ community. For example, bisexual women are twice as likely than heterosexual women to smoke and drink heavily. Minority stress is a likely contributor to the behavior. Dr. Sarah Lynham is a gynecologic oncologist. She treats patients who've experienced obstacles in their care and welcomes this report.
And now we're seeing it in hard facts as far as this is affecting the prevalence of cancer within the LGBTQ community. This is affecting long-term health outcomes, access to screening, and really tells us that we're paying attention to it, but we're not fixing the problem.
Dr. Lynham hopes the report is a wake-up call to health systems to be more inclusive. Battling stigmas and discrimination is an ongoing fight within this community. Jaleesa Irizarry introduces us to a Colorado professor who's working to help people in the LGBTQ plus community feel seen in healthcare.
On a college campus with thousands of people, there's often only one place some may feel safe.
This is my favorite place on campus because I feel seen. I just realize the impact these places have can go a really long way.
Carrie Kandrian is an associate professor at CU Anschutz. She knows how detrimental it is for LGBTQ folks to not feel seen, especially in healthcare. According to a study released by the Kaiser Family Foundation this month, 1 in every 3 LGBT adults report experiencing unfair or disrespectful treatment by a healthcare provider. 24% of those LGBT individuals say those negative experiences had an effect on their health.
The way we frame our questions, the way we ask these questions, can shut people down. It's awful.
Kandrian isn't surprised by these numbers. She spent much of her career pushing for more research like this.
Overdue.
It took a long time for anyone to listen.
We don't have data, great data on the LGBTQ community, including hospice. And so part of this grant is to help people understand how critical knowing this information, knowing who someone is, who they love, what they want, what they don't want, to radically change the way LGBT people are cared for.
Kandrian is in the middle of a 5-year grant to develop a way to improve care for LGBT older adults in hospice. She says her research shows Colorado is not immune to this issue. These numbers. She believes it's time to change that.
I hope that these reports don't allow people to continue admiring the problem and really ask them to do better.
A recent study revealed that 33% of LGBTQ plus adults say that a doctor or other healthcare provider treated them unfairly or with disrespect in the past 3 years. That's a rate twice as high as reported by people who don't identify as LGBTQ. Now we turn to our expert who says this discrimination and the stigma surrounding this group can put an individual's health at risk. Joining me now is Dr. Henry Ng. He is the director for the Center for LGBTQ+ Care at Cleveland Clinic. Thank you so much for being here.
Thank you so much for having me.
So much to talk about. Let's talk about why is gender-affirming care and primary care so important?
So in primary care, our job is to promote the health and well-being of everyone who walks through our doors. And when we take care of large communities, they're very diverse. We don't know who our patients are, and part of our job is to create a safe space for them to let them tell us who they are and what their needs are. And sexual and gender minority people, including lesbian, gay, bisexual, and transgender people, make up a lot of the diversity in our communities. And they have some health needs that sometimes have been hidden and left unaddressed by healthcare professionals.
The fact that you just brought that up, the American Cancer Society just came out with a report indicating that cancer risk is higher in this population for a number of reasons. One being, maybe smoking rates are higher. Mental health might be their risk factors are higher because a lot of people aren't comfortable even going to the doctor, and they miss preventative care.
Exactly.
The fact that a national organization came out and recognized this, what does that mean?
I think it's just a really important signal for us in healthcare to pay attention to the needs of our patients and to be aware of health needs that we may not have learned about in school or discussed a great deal in residency or our training, but these needs are real and these needs are there. Lesbian, gay, bisexual, transgender, and other gender diverse people have faced a lot of different challenges in getting to healthcare. They experience higher rates of unemployment, of being uninsured. They've experienced discrimination, physical, emotional, sometimes sexual types of abuse at the hands of healthcare professionals when they're most vulnerable seeking care. So they're folks who are really, really apprehensive to come to the healthcare professional to get care. So there are a lot of barriers in place and social determinants that make it challenging. We don't want to make it worse by not having the awareness. So it's important for healthcare professionals to to gain knowledge broadly about the needs of the people in their communities.
We always talk about being your own health advocate, but in some cases that's not necessarily very easy.
No, it's not.
What's your advice to them?
I do think it's important for people to do what they can to advocate for themselves. There are many ways to do this. You can bring someone with you to an appointment. You can have a trusted friend, colleague, family member. You certainly should try to review a practice online and see what the other patients and community members have said about their experiences going there. There are trusted different types of websites that will provide recommendations for care. So some of these are directories that you can find. These are great resources, and some of them are available through GLMA, formerly known as the Gay Lesbian Medical Association, now known as GLAMA, Health Professionals Advancing LGBT Equality.
So a lot of our show goes across the country, and there's a lot of areas that may not have access to a lot of things, but the internet is everywhere. So your advice to people who may not be out and they're still looking for those resources, where's the first place you'd send them?
I actually would go to GLAMA and then connect to the provider directory first and see who's in their area that might be nearby. We know that many people, though, live in rural areas or areas that are not close to healthcare organizations that have provided dedicated resources for LGBTQ health. But even then, there might be telehealth opportunities and virtual care that can get our foot in the door and begin the care process.
How valuable has telehealth become for the LGBTQ plus community?
It's been really wonderful, and I think it was something that needed to grow and develop before the pandemic, and frankly, the pandemic really pushed this forward for everyone. Through virtual care or telehealth, we're able to deliver many different types of care and advice and connect with patients and see how they are in their own homes and offer them some comfort that they don't have to travel as far or have the challenges of finding parking or driving to a large city or navigating large health organizations. It doesn't mean that we don't want to physically see them. Of course we do. But it gives us an opportunity to connect, build rapport, gain trust, and then welcome people to our care services.
What's your biggest concern about what's being missed in this community health-wise?
Oh gosh, there are a lot of different things. The various health challenges are broad. The ones that we've learned about over the last 30 years include things like cancer, HIV, mental health, tobacco use and substance use, to name a few. But there are many, many other health concerns where there's more and more research being done. So we're learning about cardiovascular disease and other types of healthcare conditions that are chronic. They may be more prevalent, or there may be disparities that impact sexual and gender minority people more.
Let's talk about those disparities. Okay. If somebody feels that they're not being heard by their physician, what's your advice?
Gosh, I mean, that's a really fundamental role of the healthcare professional to provide. Unfortunately, I too have worked with many patients who told me that they didn't feel heard when they've worked with other healthcare providers, or simply no one's ever asked me that, or no one's listened to me before. And I think that those are fundamental barriers to improving one's health. I think that patients, can and should bring their agendas and their concerns to their healthcare professionals. I think they can be direct, polite but direct, in saying that they did have a concern, they didn't feel heard, they would like for the concern to be addressed. It doesn't mean that as a healthcare professional I always have the answer, but I do the best I can to ensure that the patients I work with know that I've heard their concern and that I will see if I can find some help in addressing it if I can't answer their question myself.
Do you want to see healthcare facilities have better training, more diverse training when it comes to, every ethnicity, every orientation?
I think in the perfect world, in a utopian society, absolutely. We would all have the knowledge and skills and abilities needed to care for all the different people who come across our clinic door, come through our doors. We know that that's not physically possible in many cases, but it doesn't mean that we shouldn't make a strong effort toward understanding others. So beginning that process by listening to others, asking them who they are, asking what their concerns are, giving them that space to share their story. And then when we learn from them and learn that there's some specific health concerns, we can then partner with our patients to help them achieve their health goals and improve their health status.
What do you want to see training in the medical schools?
Oh gosh. So, in medical school, historically, there have only been a few hours of education dedicated to LGBTQ health content. Now, that's been gradually improving, and there's important work going on by scholars and clinicians around the country to improve this. In fact, the American Medical Association Foundation has supported a growing number of fellowships in LGBTQ health. However, those only train 1 or 2 people a year. We are really talking about the need to broadly train and provide health information and education for all kinds of healthcare professionals, not just physicians, but physician assistants and nurse practitioners and social workers, and everyone who is in the healthcare field who touches a patient should know fundamental health concerns, issues, and experiences of various different communities, including LGBTQ people. I would love to see that become a fundamental part of all health education for all health professionals.
And recruiting?
diversity matters, visibility matters. So having people in the healthcare workforce who can visibly reflect the diversity of the patient communities is really important. We've seen similar research showing that racial concordancy in healthcare areas actually improves overall health, regardless of whether or not those individuals get care.
So, best health advice you could give someone watching who maybe had a bad experience with a healthcare professional and maybe is a little skittish about going back to a doctor, what would you tell them?
You deserve to give yourself another chance to meet somebody who will care for you and care for you well. That person is out there and they're willing to do it. You were unfortunate to meet somebody this last time who did not. But there are many, many people who are willing to care for you and have the knowledge and the skills to do so. I would go and look for the directories and begin making some phone calls and looking at web pages and taking it from there. And
reach out to any LGBTQ plus organization near you.
Absolutely. If you have a local LGBTQ center, you can connect there. You can certainly look and see if a nearby health organization is listed in the Human Rights Campaign's Health Equality Index, so the HRC's HEI. There's a growing number of hospitals, clinics, and other care facilities which are demonstrating the ways that they offer affirming care for all people, including LGBT people, and certainly the number of directories like the GLAMA directory. And
I love your point about always take a friend with you.
Yeah.
Because half the time you never hear what the doctor tells you anyway. I always say record on your phone. We always have our phones with us. Record your appointment so you can go back and listen. Because I always forget what my doctor tells me anyway. So, Dr. Ng, as always, such a great pleasure talking to you. Thank you.
Thank you.
Gender-affirming care. When you hear that phrase, it's important to know it encompasses care ranging from mental health, medical, and social services. It can also refer to transition-related care that some have called life-saving. I talked with an Ohio man who underwent gender-affirming surgery, who said it takes a lot of hard work and dedication, but in the end, it's worth it. He's a 24-year-old man from Toledo, welding a future with industrial mechanics. He's a husband, a father to his wife's daughter from a previous marriage. His name?
Bobby with a Y for the chromosome that I've been missing.
Bobby Hillier was born female, but always knew his mind didn't match his body.
I was always wanted more masculine things versus what I was raised with. I wanted to be a dad and a husband. I had dreams of that when I was a kid.
He considered himself male throughout his life, but he knew he had to change his body to feel whole.
I came out to my family and started transitioning on hormones when I was about 18.
His first step, having his breast removed. Then he spent years researching how to get gender affirmation surgery.
I thought I'd have to travel across the country. I thought I'd have to travel hours and hours, fly maybe, and budget for a hotel.
Fortunately, Bobby was wrong. The help he needed was 2 hours east. University hospitals recruited urologist Dr. Shabam Gupta to be part of the hospital's LGBTQ gender care team. Phalloplasty is one of his specialties.
Phalloplasty is arguably the holy grail of reconstruction as it comes to urology and plastic surgery. And basically what phalloplasty is just making a new penis.
But it also has to work.
You can urinate through it and then has other sexual effects, sexual characteristics, attributes of a penis.
The complex surgery is in 3 phases and can take more than a year to complete. In December, Bobby underwent a hysterectomy. Then in February, had phase 1. It's a long and complicated procedure.
Ready to start the beginning of my journey. No, I never thought I'd be able to be a 20-something and comfortable in the body that I have. So this is kind of a dream.
Skin from his left arm would transform him.
We use that tissue to make a urethra, the tube that men pee out of, as well as the outer penile tissue.
While Dr. Gupta does the functional part, plastic surgeon Dr. Tobias Long works at the same time to make it appear like it should. Both doctors say the clinic started because there is a need. Dr. Gupta estimates about 40,000 transgender people live in Ohio. Their clinic is busy.
Now it's every week, and now we're doing surgeries on a weekly basis.
About 3/4 of the patients are local.
It's much safer from both, to be able to do something locally, especially this technical, both from a recovery aspect and being close to your surgeons if there are any issues.
Gender affirmation surgery is covered by most insurance, but for those who must pay out of pocket, phalloplasty can cost up to $150,000. Less than 3% of patients have risk of serious complications, which is another reason having a clinic closer to home is a safer option.
I want to be safe.
Bobby's first surgery went very well. In July, he'll be ready for phase 2.
It takes a lot of hard work and dedication, but in the end, you're going to see yourself the way you saw yourself in your dreams.
Research shows about 40% of the people in the LGBTQ plus community are people of color, and that can come with its own set of challenges. When it comes to access to services such as healthcare and mental health resources, Hispanic LGBTQ plus individuals face high rates of discrimination. That's according to research from UCLA. As many as 74% of Latinx LGBTQ adults reported having experienced everyday discrimination.
The Latina community can be very traditional, and I think we are taught growing up a lot of bad and wrong information about what it means to be LGBTQ. So it's a lot of things to navigate.
One of the things that I have found is that we do have a lot of trauma within our culture, intergenerational trauma. And when you grow up in an environment where your trauma is dismissed and where mental health is stigmatized, you don't realize that what you're dealing with is something you can get help with.
Mental health disparities also persist within the Black LGBTQ plus communities, where individuals often face unique challenges due to systemic discrimination. Our station in Portland takes a look at a group dedicated to providing support for African American LGBTQ persons and their families.
LGBTQ activist Khalil Edwards receives the Emerald Award.
Antoinette Edwards is a proud mother.
Given by a Black sorority chapter. That was pretty significant.
As she reflects on the family's journey, making a difference within the Black LGBTQ plus community.
We are the co-founders with our son of the first Black PFLAG in the nation.
The very first PFLAG chapter dates back to 1973 with the mission to support and advocate for LGBTQ plus people and their families.
And we were blessed to be on many Hispanic news.
But it wasn't until 2009 when the Edwards noticed a need specifically for their Black community.
Well, they take the brunt of being Black and being gay. So it's very challenging, and there was no one to advocate for them. There was no respite or place for them to go to feel comfortable.
For years, the Edwards home was that safe space for their gay son Khalil and his friends, a haven with judgment-free support not everyone had.
Just because you're not gay doesn't mean you don't stand up for the gay community. They're human beings as well.
When you don't have those basic needs met and you feel alone, that's devastating to your psyche, your mental health, your overall well-being.
So they made it their mission to bring that sense of belonging to more people.
It's life-changing. It could make the difference between life and death.
According to the Trevor Project, a nonprofit focused on suicide prevention among the LGBTQ plus community, more than 1.8 million young people consider suicide each year in the U.S., and at least one attempts suicide every 45 seconds.
And if we can just lead with love, we can see things differently, but if we lead with love, there's enough space for all of us to coexist. And America is crying for that, screaming for that, and we can contribute to that. We can make a difference. Yeah, we got lots of
Daisy Caballero, KGW News.
That'll do it for this edition of Prescription for Life. Thank you so much for watching. We'll be back next week with another dose. Until then, I'm Monica Robbins, wishing you and yours good health.